Hi, my name is Dr. Fox. I'm one of the veterinarians and practice owners here at DePorre Veterinary Hospital, and I'm going to be answering some questions today about urgent cares and our urgent care appointments. So urgent care situations are really anything that is clearly your pet isn't doing well and can't just wait for the next regular appointment. So certainly the obvious things people think about are, your pet's not eating, a lot of vomiting, diarrhea, really significant GI issues. That definitely would qualify for something as an urgent care. But even sometimes just if your pet's in a lot of discomfort, it has a really, really bad ear infection and your pet is clearly struggling and not feeling well, that could also be considered an urgent care. Even a bladder infection or indications of changes in urination or drinking a lot more water or not drinking enough, where you're concerned that there's something really wrong and we need to get an answer as soon as possible. One of the other areas that definitely can become more of an urgent issue that your pet needs to be seen sooner is anything going on with the eyes. So if you're seeing squinting, rubbing, a lot of discomfort, really holding an eye shut, anything specific like that, those pets definitely need to be seen sooner than later to make sure there's nothing more serious going on with their eyes. I think it's a little bit of a judgment call based on you knowing your pet and how sick they are and if they can wait. We do have scheduled blocks for urgent care appointments that we don't really allow to be scheduled until about 24 hours ahead of time. And so we would encourage you to call. We typically have one of our licensed technicians who is designated to help answer questions and help determine with a conversation with you if there's any question if this is urgent or not and if it can wait or not, to try to help walk you through that process a little bit. Sometimes there's something wrong, we need to come right in. But sometimes it is a little bit of a grayer area and you might be able to wait for the next open appointment, which could be the next day or within a couple days. If you know something's definitely wrong, then clearly coming in for an urgent care is certainly warranted, but certainly happy to help through asking some questions and speaking with one of our licensed veterinary technicians who have a great knowledge base to help guide if we think on our end that it's something that should be considered more urgent. Symptoms, I would say not eating, and I'm not talking like, maybe missing one meal, but if there's clearly, your pet. So if missing one meal is significant, then maybe that is significant. But, not eating for more than 24 hours, changes in urination habits, changes in vomiting, diarrhea, really lethargic, acting in any type of really severe discomfort, anything that you just feel can't wait. I mean, honestly, there's a lot of different reasons and every pet's a little bit different in how they handle those situations. So if there's any concern, we would always recommend coming in and at least starting with a good exam so we can help determine what level of testing, if any, needs to be done. So an emergency is your pet is not stable and you're not sure that they can even wait for an appointment. So emergency is whether it's the middle of the night, whether it's Sunday afternoon, you're getting in the car and you're getting seen as soon as possible. Urgent cares typically are going to be patients that are more stable, and although it might be urgent and they want to be seen, you're not in a crisis where this is an emergency that you're not sure if your pet's going to make it in that kind of acute setting. So I think some patients can be a little bit of a gray area, and so certainly if there's any questions, we're happy to answer that and help determine, it sounds like your patient's stable, go ahead and come in, let's schedule an urgent care appointment, and usually that's going to be the same day. Or if it's really an emergency, I always tell people, you should be calling on the way, and either it's coming here, or if you're closer to one of the local emergency hospitals, go there. I mean, it's really just getting your pet seen as absolutely quickly as possible and making sure that we can get them stabilized, or if they need to be at one of the local emergency hospitals, then that's fine too. We just want to do what we can to make sure your pet's getting the best care as soon as possible. So generally we have designated urgent care appointments to help facilitate so that people aren't waiting as long. You and your pet are getting that individual time with the doctor. So generally we recommend always calling. We will schedule you as an urgent care appointment. If it is something where our urgent care appointments are kind of filled for the day, then we would have you talk to one of our technicians, and if it's still deemed that this is urgent, and especially if you're one of our regular patients that we see, we might say come on in and you might have to wait a little bit longer, but we would get you seen. And sometimes when you talk to one of the staff members, they're able to give some suggestions and say, okay, let's schedule you first thing tomorrow morning, do this and this tonight, and obviously, we would plan to see them in the morning. So because there could be a variety of reasons, sometimes the recommendations can vary a little bit as well to just make sure that we're getting your pet seen as soon as we can. So we pretty much do all of our normal diagnostics and treatments. So x-rays, in-house lab work. A lot of our patients that are coming in for urgent care is because they're sick, we will end up running more diagnostics in-house rather than sending them out to the reference lab and waiting a day or two to get results. So we have a full in-house lab, so running urinalysis, ear cytology, skin cytologies, full lab work, blood work, x-rays, ultrasounds. From a diagnostic perspective, we pretty much have all of our normal capabilities for all of our urgent care appointments. In terms of treatments, some patients end up having to stay and be hospitalized. If it's something that warrants surgery, then that would be something that we could potentially do surgery that same day, depending on what it was. If it's a laceration or something like that that needs to be closed, or if it's a pet who's eaten a bunch of socks that needs to have those surgically removed. A lot of times we can help facilitate that either here, or if it's something, depending on the time of day, that we think can't wait till the next day, might be something that we would have you go to emergency for further supportive care and overnight care at that point. I would say if you have a scheduled urgent care appointment and while you're waiting for that appointment, your pet is getting worse, we would say you just need to call and we would probably have you come right over. It's helpful if you call, and that way we can talk and make sure that this isn't something critical that your pet needs to go right to emergency. But most of the time we would just say, just come over, we'll just get you seen as soon as we can. But it definitely is helpful if you can call. We don't want people showing up and then ending up having to wait longer than what we would want them to wait, or their pets to wait as well. Yeah, sometimes follow appointments are necessary because, it might be an urgent issue when you come in, but then we need to do a normal scheduled follow-up, recheck exam, whether it's an elevation and some lab work, or some abnormalities in an x-ray or something like that. We might say, okay, come back in a week or 2 days, or depending on what we need to recheck and when. And a lot of times we'll just schedule that as a normal appointment. So, and sometimes if you're seeing one of the doctors who's working urgent cares that day, and then you might do your follow-up with your regular veterinarian here, and that's fine too. We do think it's really important to collaborate as much as possible. So anytime that you see a different doctor for an urgent care because you needed to be seen right away, there's still a lot of collaboration that's happening with your regular doctor if your pet normally sees a specific veterinarian. So during the urgent care exam, I think the most critical thing that's going to happen is a really thorough, detailed, kind of like nose to tail physical exam. So we're going to kind of look everything over. And depending on what issues are going on, we might be focused in certain areas of the physical exam. But the physical exam for sure is happening, and that's probably the most important part of the exam, or the most important part of the appointment, to really give us some direction. Based on that exam, then the doctor may recommend specific testing to get to the bottom of what's causing it. Whether it's ear swabs and an ear cytology, whether it's getting a urine sample for urinalysis, whether it's blood work, x-rays, whatever diagnostics we think we need to do to kind of get us on the right plan to get things treated as soon as possible. Well, I was happy to chat about urgent cares today. Thanks so much for your time. If you have any other questions, don't hesitate to reach out to myself or any of the veterinarians here at DePorre Veterinary Hospital.